Good morning.
Oh, there we go.
Good morning, everybody. My name is Dr. Sarvar, and I have Hilary Stewart with us. She is the health coach, and we are going to be working towards a series of live videos, and we are going to start off with talking about summer activities, ergonomics, and especially back pain. So I am going to go over different pieces of the back pain, like alignment, core, and posture. And Hilary is going to talk about?
I am going to talk about ways to make sure that you're more mindful of your posture. So dealing with ergonomics, whether you are sitting, whether you are standing, whether you are traveling, at home, just kind of everything.
So we're going to go right into this live series. We're going to do this typically on a Thursday, but you're welcome to watch whenever you want to watch. And we're going to go over different pieces of education. We're calling this series the Thrive Over 45 live series. So tips and suggestions and testimonials from the people that we serve and the things that we find in our 45 plus population that we want to enhance, help them get stronger, more mobile, move better, feel more pain-free. So let's start with the back pain and alignment. So what we find, and I have a little model here of a pelvis. So what you see here is the back of the spinal column, and these are the spinous processes, and these are your sides, sort of the sacroiliac joint and the tailbone. And what we find commonly is that if there's any malalignment, let's say if one side is tilting towards one or the other side, then you typically get discomfort and pain. When you look at a bigger spinal model, you notice this could be a rotation one way, it could be a spinal drop another way, which then affects your leg length, and typically happens when you are, let's say, sitting for long durations, driving for long durations. So it's important to work on the alignment and getting the pelvis in the right position. And we do that with different manual therapy techniques, and the way we diagnose it by observation, looking at the correct pelvic position. And so it's important when you're feeling stretched or tight on one side, just kind of revisit how is your leg length and how is your alignment. Talking about sedentary postures, Hilary is going to talk about ergonomics.
Thank you, Sarvar. That was very enlightening, and I am actually going through lower back pain myself right now. So yes. Having those exercises really does help a lot. I was going to talk about ergonomics when you are traveling, because a lot of us, with it being August or almost August, and traveling is a big activity that a lot of us do. Sitting in the car for an extended period of time, it can really cause your spine to compress and not being able to stretch your body, muscles tighten up. Giving yourself that chance to stretch, giving yourself breaks, taking breaks when you're driving long trips. If you feel like your body's getting tired, pull over, find a spot, a safe spot, and just work on some stretches. Also, keeping a pillow or something, a rolled little small pillow or a rolled towel right at the base of your back is going to help with that support while you're driving as well.
Yes, and what that brings us to is the core stability, and that's the second thing I was going to talk about, is the core strength, the alignment of your spine. So again, looking at the spinal model, typically when we think of core, we think of the six-pack abs, the ones right in the middle. You see it on the video, see it on Hollywood, a lot of ads for weight loss. You see those, but the real deep core muscles are the ones that are positioned at a very, very smaller scale between the spinous and the transverse processes. These are the transverse process of the spine, and then these are the spinous process. It's called the interspinalis, the intertransversi, and then between the pillars of the spine called the multifidus, and there's a encircling muscle that goes around that sort of acts like a brace around your waist and pelvis, is the transverse abdominis. So these are the important deep core muscles that really are essential key to stability of your spine. And so when we are talking about core stability, these are the spinal muscles that we target. And there are multiple research that proves that if you have back pain, these are the first set of muscles that atrophy, which means they weaken and they don't really activate until you really focus on activating these muscles. There are certain exercises that help you get there. We do it by palpation, by sort of feeling the muscles, giving you the correct cues, doing pelvic floor activation, tucking the tummy activation, and then obviously checking the alignment of the spine when you're doing it. So specific core stability exercises are essential for eradicating back pain. And it's something that you will experience, when you, sometimes you experience when you wake up in the morning, and it's just that the core isn't fully active. You just spend the time to activate the core by doing that.
And very important as we age, because with our changing bodies, I can definitely attest to being able to kind of relieve pain and stuff like that when I wake up in the morning. Next topic I was going to talk about, kind of related to core stability, is outdoor activities. During the summer, many of us spend more time than we usually do outside, and particularly yard work, yard activities. And when we're doing yard work, it's easy to just kind of move your body in every different way. But just being more mindful of your posture when you were, saying, gardening and having to squat. You always want to bend at the hips.
Yeah.
Right?
It's kind of more this motion versus just like straight down
and
with the
arching.
knees straight and bowing. So just kind of a little bit of this squat to
not arching your back.
Yes.
Yeah.
Right.
And then just be mindful of your knees. If you're having to squat down, taking like a knee pad or some kind of cushion or something. Sometimes they have those knee pads that you can, with the Velcro on the back, that kind of go around your leg there, so that you can be on your knees while you're gardening and protect your knees. And also, like when you are raking, right, kind of trying to use one side, like people tend to do that when they just are stronger one-sided, and they just kind of get carried away with, I got to get this done, so. Definitely true. So like it prepare you for fall when the leaves start falling and you start raking more. If you're right-handed or left-handed, just kind of alternating different sides uses more muscles. Yep, very good, very good. And then the third and the last thing that I will be talking about is posture. So looking at the alignment, looking at the core, coming to posture is how is your spine aligning on top of each other. So we look at the back view of the spine here. We obviously want the entire position to be pretty straight, not tilted one way or another, which can create scoliotic curvatures. But then when we look at from the side, there is this subtle spinal curvature that our body naturally has. On the cervical spine, there is called the cervical lordosis. The thoracic spine is the kyphosis, and the lumbar spine, again, the lordosis. And that pelvis is angled slightly down about 15 to 25 degrees from neutral. So when we are doing the posture alignment and check, if we notice that the pelvis is tilted super forward, which is common in a lot of women, obviously they have to carry the babies, their pelvis is wider. So that is a typical notice we find. And then we've got Pete the cat in the background checking out the alignment and posture here. And then also talking about the thoracic spine, desk workers, computer users tend to be too far forward on the thoracic spine. And then the head being like super forward head. And I'll ask Hilary to kind of demonstrate what that forward head could look like, if I may have you just from the side and just step forward just a little there. And then working on the computer and having the head quite forward, so you look at the ear, the shoulder, versus then being able to tuck the chin and correcting the curvature like so,
and having that proper alignment there. So important. Did you feel
that feels a lot better?
Yeah. The level of stress. Actually, they say that the head weighs about 10 to 20% of your body weight, and so it's quite heavy. And then when you have that amount of weight that is, leaning onto your neck, it puts a lot of strain on the neck. The further away it goes as a lever. Mm-hmm. So just trying to keep it on top of each other in line is very, very important.
Yeah, definitely. Like when you're at home working on your computer or at work working on your computer, that's definitely something to keep in mind.
Yeah.
Because it does over time. Your body shape changes when you hover over your phone all day long or you're slouched in front of a computer. I know that that bone, what do you call that bone?
The cervical spine, sort of the nuchal C7, level C7.
Sounds good to me. Yeah, that thing sticks out, and
yeah.
we and then you get back pain eventually. You might not have pain when you're doing all this, but as you get older and your body changes, you're going to start to feel the effects. So you can start changing the way that you sit sooner. You can prevent yourself from a future of pain.
Yeah. So there was one more thing that I know you had on your mind for the ergonomic side.
Being able to support your back too.
That's right.
Yes. And taking breaks. We want to make sure that we're taking breaks in our day. It's easy to forget when you're so involved in a lot of work, but your body will thank you.
Yes.
To take those breaks. What they suggest.
The sitting, yeah.
Sitting. So after sitting for about 35 to 45 minutes, generally it's good to get up, to do some stretches, just move your body, move those muscles. And then you can go back to work. And then typically about every hour or so, it's really good if you can to just take a walk. Just take a walk around your room, take a walk outside, get some fresh air.
Yeah.
You like to walk.
Yeah. Walking. I mean, really this morning, I and Fahim, we were not only just walking, but we've discovered a new term called jeffing, which is like a walk and a run, alternating. And it's actually an Olympian whose first name is Jeffrey, who coined it. So it is a real thing. You can look it up, called jeffing, where it's been researched that your walking and running combination helps you with a lot of cardio and other components. But that's more of an exercise. We're right now talking about like in between breaks, like an hour, take a 5-minute walk, just change your vision, the lenses, muscles contract when you're nearsighted or looking at a near things versus then farther objects, also your focus, vision.
I mean, you can work more productively during your day when you give yourself breaks too.
Yeah.
So it's not just a physical thing, it's a mental thing.
Yeah. Awesome. Very good. Well, thank you so much for viewing our very first Thrive Over 45 Live. And we'll be continuing to bring you guys with more knowledge. So stay tuned. Thank you so much.
Bye.